Hello and welcome to Paracelsus Clinic in Lustmühle, Switzerland. My name is Wanvig and I'm here of two reasons. One, I'm as a patient here. I've been chronically ill for 14 years, and after a burnout in 2003, I've been a shadow of myself. I've been through so many therapies, so many medical Western school medicine doctors, so many holistic treatments. I spent a fortune, a seven-figure fortune in euros of my own pocket to become healthy. And so far, after 14 years, I still are 20% of myself coming to my energy level, my focus, my brain. Yes, the healing I've done during these 14 years, I brought a lot. It brought me happiness, it brought me meaning, it brought me love in life, but my physical health never was regenerating. Today I sit with the medical director of the Paracelsus Clinic, who will guide me through my healing process at the clinic. Welcome, Dr. Rau.
Thank you very much. Welcome to you too as a patient and as somebody who wants to bring out our medicine to the world.
The first question I have to Dr. Rau is, I've been to so many Western school medicines, doctors, professors, hospitals, and nobody have been finding the reason why I'm ill. They all say, oh, it's depression, Mr. Wanvig, or everything is pathological, no problem with you. Why is it like this that they don't are able to help people who is chronically ill?
The problem is that nowadays diseases are different than what they were even 30 years ago. We should no more think in diagnosis, so to say stamp, like somebody has multiple sclerosis or rheumatoid arthritis or colitis or, but we should think in systems, in dynamic processes, and our thinking should go down to the cell, the basis of the body's function. And many diseases which are unclear, they are just unclear because they do no more fit into diagnosis which the doctors can find. Our orthodox medicine is trained and highly developed for mechanical things, for things which you can see and test, but the tests, they do not really go all down to the cellular function. So when I look at my patients who comes to Lustmühle, so to my Paracelsus Clinic, well, we only have the negative cases, the bad cases.
Yes.
So the others, the good ones, the easy ones, they don't come here. This is why I see a lot of patients, many, we have hundreds of patients who have chronic fatigue, burnout, fibromyalgia, autoimmune diseases of different, non-really specific expressions, or even cognitive decline or mental diseases. No, nothing is found. And I just had before a professor from the university hospital, the man who was here, highest reputation. A family member of him is non-detectable sick, but this patient is sick. So can't work, can't stand up, is only tired, and of course they didn't find anything, and so they said, this psychological. Always when you do not find with the conventional doctors, they say it's psychovegetative, it is psychological.
Yes.
And then they begin to give antidepressants, whatever. So, but they do not really look at the cells, at the metabolism. When I see, now we come back to my patients, what they have, all these unclear diseases, including cancer. About half of my patients are cancer patients. So we see they are toxic. They can't detoxify because they have a cellular deficiency on detoxification. Nobody ever tests this. Or they have a heavy metal load. Look at the heavy metal load on a patient who was undetectable, a psycho-vegetative person with chronic fatigue. Highest mercury level, very high arsenic level, and cadmium level. Well, all these heavy metals or toxic metals, they make nerve cell blockage. So the metabolism is blocked. And how can this cell be vital if it's permanently blocked? And if then we detoxify the patient, they get psychologically better, the depression disappears, but it's a long-term process. But it's not only heavy metals, it's other toxins like bisphenols, like perfluorochloric acid, like all these organic, we call them xenohormones. These are the things which we test, and also neurotoxic toxins from the bacteria, Clostridia. All my patients who have these undefinable diseases, they always have, now comes the second pillar of Dr. Rau's 3 steps, is the intestinal health. And we have to rebuild in all these patients our intestinal health. The site of life forces, but also the site of lymph cells, of the immune system. And then the third one, which is the effect on you, is that you have been blocked so much, cellularly blocked by years of antibiotics. And it's known that these antibiotics, they are counteracting, as an example, the coenzyme Q10, which is basically on the cells. They work, nickel works against the zinc, which is the basic catalyst for energy building in the mitochondria. So your mitochondria probably are significantly blocked. So each cell just doesn't work enough. This is why you have energy like a 90-year-old.
Yes.
And we find this more and more and more in the Western world.
This is like it seems like the chronic illnesses is like an epidemic who is going in the Western world, and I see also more and more young people are getting these chronic illnesses. How comes?
The average Swiss school child gets 4 times antibiotics per year, average. So, and the Americans, they have the so-called disease, Lyme disease, which is super epidemic. But it's only an argument to provide antibiotics for long term, which is good for the pharmaceuticals, but also to block their metabolic pathways, so that 5 years later they come across like you. Antibiotics long term decrease the cell metabolism and makes afterwards other diseases.
You know that the Western school medicine doctors, you once was one, huh? Only medical doctor, specialist in general medicine and rheumatology.
Yep.
What was your path from being a traditional medical doctor and to the more holistic approach?
This is very simple. It sounds a little bit overcritical. Honestly, as a rheumatologist, my patients just did not get healthy. So they came again and again. They were even though we had so beautiful remedies which took away the pain and the inflammation, but as soon as they stopped, it came even worse. So they got worse and worse. It's frustrating. Well, then next step is, are you an individual with big ears and big eyes and open mind? Then you have to be critical and ask why and what, why is this and what can I do? So I had patients, they came and said, "Oh, Dr. Rau, I'm now much better." But they were in 5 years in my treatment. And what did you do? Normally, doctors don't ask if a patient gets mysterically healed. What did you do? Oh, I did a rebuilding of the intestines, or I did a detoxification, or acid-base metabolism. What? Acid-base metabolism? What is this? Doctors don't know. So hyperacidity. Well, Dr. So-and-so, he has a program. And then instead of telling, that's quackery. I asked Dr. So-and-so, what did you do on our mutual patient? And he said, well, I did detoxification, or I did deacidification. And then I asked, well, can you explain? Then he began, well, next step, can I come to look what you do? And my wife and myself, for I would say nearly 20 years, we spent part of our holidays just to visit doctors all over the world who did something special. And this is biological medicine. Biological medicine means we have to provide a change of cellular metabolism to the body. And this is a primary medicine. We are not complementary. We are the basic medicine. And if you do it correct, only in few cases, in completion to us, we need orthodox medicine. Orthodox medicine is complementary to what we do. Yeah, but we have to do it strict. Dr. Rau makes a strict treatment. Detoxification, intestinal upbuilding, cellular rebuilding.
So, before I was coming to the clinic, I was through a very in-depth questionnaire where the clinic was asking me a lot of questions if I was also willing to be a part of the healing process, if I was willing to change, if I was willing to do nutrition. And I guess this is a part to find also your patients who you can work with. Self-responsibility is an important part of this clinic.
You know, our medicine is biological. This means bios is for the body and logical. So it's logic. So we can explain. And if you are willing to accept what we explain and to do, then you will be your own doctor. I only guide you. Where to go, I can explain. But you do it yourself. This is why we ask, are you willing to change your nutrition? Because nutrition changes the metabolism of the body. Are you willing to go into a long time treatment? Because rebuilding of the organs takes months to years. And are you willing to do a permanent treatment for yourself, which is not a permanent dependence from the doctor? It is something which you do yourself.
So you want to empower your patients.
Exactly.
Not being in need of the doctor, but being selbstständig and...
Genau. Yeah. And this is that's why I write books. I have the three English language books, now even 4. And that's we explain to the patients.
So one of the most basic fundamentals for patients coming to you, including me, is the diet. Can you explain a little bit about the basic principle of Dr. Rau's way and Dr. Rau's diet?
Dr. Rau's diet bases on the thinking of the Dr. Rau's biological medicine, which contains the 3 pillars. Our diet has to have little toxins, because pillar 1 is toxic load. So we can't re-intoxify all the time. We have to do a diet which is non-toxic, which is more or less plant organic. Next is the intestinal system and the immune system. More than 90% of our cancer patients, they have, and around 80% of our chronic patients. And when you look at the road in Switzerland, 60% of average population has food intolerances. And when they eat these food intolerances, they irritate their intestines. So it gives a permanent stimulus or negative stimulus, and it destroys the intestine, which is also destroying the intestinal immune system, which has a relation to the autonomic nerve system and the brain. Even the Americans now, they realize that there is a gut-brain correlation. Well, we speak about this since 50 years. So these are the important things. You can only heal your body if your biggest organ and your immune system, which is the intestines, are healthy. So we make a healthy diet for the intestines. And this, when the patient comes, I shoot from the hip and I say, you don't take any dairy products, no white sugar, no gluten. Well, this is like John Wayne, you shoot from the hip. But afterwards we test against what the patient is really allergic, and then we can do the fine-tuning. This takes about 1 to 3 weeks. But knowing that 90% of our patients anyhow are intolerant to beta-lactoprotein from the cow's milk, well, I tell them no dairy product. This is the background. And then the third part is, that's what you can get in our hotel, is trace element rich food. Grains, we integrate nuts, leafy green vegetables, some part is raw, some is not raw, absolutely no sugar and no dairy products. And these kind of things we give so that you can re-feed your organism with the needed trace elements and amino acids.
And with this diet and everything else you are doing, you're talking about experience, because you are not been dreaming this or reading it in a book. You have been treating, as I read, more than 30,000 patients the last years in this clinic from more than 80 countries. And I see the success rate you have with cancer, Lyme's, chronic diseases are pretty extraordinary. This diet is, as I understand it, a product of your experience with your patients.
Yes. Yes, absolutely. This the development of Dr. Rau's hypoallergenic diet is a result of 30 years. It's very sophisticated, it's quite individualized. We have the basic rules, but in addition we can individualize. And it's just based on a lot of experience. And especially, I would say, hardly any doctor has so much experience with biological treatment of cancer and autoimmune diseases. And now more and more we get these unclear diseases, like you have, or like autistic children. It is epidemic, it's a horrible story with the autism. And we have solutions. Or the so-called Lyme patients. The so-called, for me this is not a disease. It is a toxic load on which this bacteria can, in addition, make some expression.
Talking about Lyme's disease, this is also like epidemic, especially in Europe and US, and where I'm coming from, Norway, it is pretty extraordinary. And I heard so many different ways of treating Lyme's, but very few are successful. The worst case I heard, 6 months of antibiotics from functional medicines, someone told me. What is your shot on healing Lyme's, and what kind of success rate do you have in your clinic?
It's very simple. Dr. Rau's 3 pillars. Detoxification, we look which pathways the patient can make. Rebuilding of the intestinal flora and rebuilding of the cell. We rebuild your body cell by cell. This is my slogan. And if you have tetracyclines, which normally they give in beginning of the Lyme, so-called Lyme disease, then you destroy the bacteria's cell walls. You destroy your intestinal health. This is the beginning of neurological problems. But it takes a certain time. When they give even more deep-going antibiotics, some of them even contain toxins like rocephin, which contains mercury, and then you intoxify the body even more. So we detoxify, we rebuild the intestinal health, and we rebuild the cellular metabolism. This is individual, very individualized. Our success rate sounds extremely arrogant, but our success rate in Lyme disease is nearly 100%.
That is
even, and we only get the bad cases. But it takes long, and I never use antibiotics. We even detoxify from the damage of antibiotics.
What is typical time? Also, if you have Lyme disease, what is typical healing times approximately?
When I look at this typical mid-age or young American girl or man, they come with 20 and they are invalidized. They can't work anymore. They only sleep anymore. They have pain. They are psyche. And when I look at these so-called Lyme diseases, it takes several months, up to 2 years. But they feel after 3 weeks here, they feel much better, even though they are not yet healed.
Yeah.
But then we give a program for at home.
So you do the rest home?
Yeah, we do not work against the Borrelia burgdorferi. We work for the cells of this patient.
So you say
this is the difference. And we work against, or again for the patient, against the co-infection viruses, which very often makes more damage than the Lyme bacteria itself.
So you say also the problem here is not the borreliosis, it's the body's ability to deal with the bacteria.
Yes.
I saw in a speech you gave that the borreliosis is not a dangerous bacteria, but it's dangerous when the body is too weak and too toxic.
Yes, when the body is toxic, then the bacteria love this milieu. It's interesting, they made along the River Rhine, they make tests. You know, Lyme is this little town in Connecticut, eastern North America, so New England. And there is humid, foresty, with little lakes, this area. Beautiful area, Lyme. So, and there are the deer and the ticks. But exactly the same situation we have along the River Rhine, in Schaffhausen, in the area of Black Forest. It's the same climate, the same humidity, the same river, and so deers as much can be. So they have ticks all over. And they tested forest workers, children from the villages, in the schools, and farmers. And they found more than 90% they fulfill the criteria of the diagnosis Lyme, but they were healthy as can be. So this diagnosis, this bacteria antibody, and even the Western blot test does not really explain the multi-symptom diseases which these patients have. These are two different things. But it's fantastic for the pharmaceuticals and the doctors. They can say, oh, you have Borrelia burgdorferi. We have to treat you for this. And then they can treat for years and years. It will never get better because they do not really remove the causes. We look for the causes and we individually work on these causes, and then Lyme disease disappears.
Before we go into a little bit about your excellent result treating cancer, I would go into the diagnosing, also the holistic diagnosing, because this is an essential part of my stay. The first part of my stay, these 2 days, has been only diagnosing. I've gone from one station to the other, and yes, tell a little about the importance of the right diagnosing and what you are doing to diagnose the problem, the underlying root cause of the problem.
Come to my seminars. We teach about biological treatment of cancer a lot. So, because this is, I would say, the masterpiece of biological medicine. And now comes, this is a complicated part, now comes the simple part. You follow Dr. Rau's 3 pillars. Detoxification, immune upbuilding, intestinal upbuilding, and the rebuilding of the cells. If you do this, the cancer cell has much less chance to spread, because they need a very specific metabolism which enables them to grow. So cancer is a milieu disease. Of course, cancer begins to grow and the big lump can make a damage. Of course. So we do a testing for all the reasons why you could have cancer, what could have activated this. We do the panoramic X-ray. We do a lot of tests which no oncologist does. All these tests for viruses, for toxic load, for xenohormones. There are so many toxic influences which are cancerogenic, like cadmium. Well, we find cadmium in the patients. When I ask the tox professor, you know, from this is the state lab of toxicology, it's not some kitchen lab. So when I asked him, Professor Koslin, what is the finding of other oncological clinics? Do they also find in all the breast cancer xenohormones, cancerogenic hormones, which you can test? Well, you are the only one in Switzerland who does these tests. Honestly, who is specialist here and who is narrowist?
So if we come back to diagnosing, the first 2 days of my stay now has been diagnosing all the time from different stations. And the first I was sent to was the dentist. And why is this so important, both for chronic illnesses, cancer, and all these kind of difficult illnesses? Why is the teeth so important?
Each tooth is connected to a meridian. The meridian is a something which the Chinese medicine, they developed the thinking of meridians. And they have proven on thousands of years, on billions of patients, they have proven this fact that organs, they belong together. There is a connection between organs in their function. And they have 5 functional circles. That's Chinese medicine. It's not my invention at all. But at the end or the beginning of these meridians, always at the end of the beginning, there are teeth. And this tooth, or each meridian, has different teeth which belong to them. So there is a connection between the tooth and the organs. So we know from experience which tooth belongs to which meridian and which meridian belongs to which organs. This is one thing. And the other thing is that the teeth are nowadays also a site of toxic load. Patients get root canals, and the root canal filling material still contains formaldehyde, antibiotics, preservatives, highly toxic materials. The dentists say, well, this is in the tooth and it doesn't come out, but this is not true. It's provides each root canal provides a subclinical toxic load to the patient. And we have tests to test the toxic washout and even the inflammatory reaction to these toxins with cytokines, which we test, with RANTES, is a specific cytokine, which is dental cytokine, and we can test these things, and heavy metals. So, this is one thing. The tooth as a meridian part, which interacts, and the tooth as a toxic source. This is why every patient has to have a picture like this on day one. Before I even shake hands, they have to do this. Why? Because in our patients, more than 90% of our patients, they have significant load on the toxic, on the dental situation. Toxic electricity, meridian disturbance, inflammatory on the teeth. And they normally do not really feel it.
Like to me, I've been to so many dentists who say everything is okay with you, Mr. Wanvig. There is no problem. What can you tell about this? This is my teeth.
Yes, this is your dental panoramic X-ray. It's not a good printout, but look at that. What we see here, you have a focus. The bone between these teeth falls apart. This is a chronic osteitis, and you have superissimo bad. You have these two teeth impacted. The wisdom tooth is impacted. So dentists don't like to see this because it's difficult to remove. It's not simple. They don't like this because it is very close to the sinus, very close to the sinus, and here even presses to the neighbor tooth. And you see pocket here of bacteria. This is bacterial meridian and sinus irritation. This makes chronic diseases. Now, I take my tooth chart, the correlation chart between teeth, and I can see small intestine and heart. These two teeth belong to the small intestines and heart, and they make a permanent irritation. But you don't feel it here, you feel it on another side. Small intestine is the site of your immune system, and the heart is the site of the heart, of course. So I just have now a patient who was super VIP from Far Eastern country, and he comes and I say, well, super VIP or not, billionaire or not, I don't care at all. You go to the dentist. And what did we find? We found that he had a two wisdom teeth sincerely infected and impacted, not come out. So he, as a person like him, he went to Germany, he went to cardiologist because he had an intermittent atrial fibrillation. He got ablation of his atrium, for this atrium of the heart, because it was irritating. But it was not irritating, then it was irritating again. According to what he ate, because he also had a small intestinal food intolerance. So the tooth plus the irritation on the same meridian made the heart jump. And 2 ablations did not work. Electroablation did not work on him. It came back. Why? Because the cause was not removed. I told him, you don't need anticoagulation, you need dental work. And he did the dental work, and since he removed the tooth, we found a chronic infected area. When we removed the tooth, old pus came out. And now he's still here for several days. He's putrefying all the time, but not a single extrasystole anymore. Now we just did a 24-hour EKG. Atrial fibrillation disappeared. So this is only one cause. I could have so many causes between dental and cancer.
And you see this when you have cancer patients and you remove the stuff from the mouth, the problems, then you see how they are regenerating like magic. Is this so?
Yes, of course, it is not only this treatment. Like in this lady here, I have to erase the name, this lady here, 80 years old, she has a pleura mesothelioma, highly malignant lung cancer, highly. Normally they die within months. This is a picture from February. Well, she came lung full of water, that's why she came. We punctuated, we began our cancer treatment, no chemo, no radiation, no operation, only pulling water out and pulling our remedies in. I told her, Mrs. So-and-so, you have foci. Look at this. You have this tooth is absolutely, it flows in pus more or less. This one. Well, here are implants. We don't like these titanium implants, and here you have 2 root canals. This is on a lung tooth. These are 2 lung teeth, and here also. You have 4 infected lung meridian teeth. You have to remove. No, you do cancer treatment now. No, I don't remove. Well, after several weeks I said, look, Mrs. So-and-so, go to an oncologist if you want. I can't do this treatment if you don't remove the tooth. This is my practice, my experience of nearly 30 years. So she did, and 2 days after she called, unbelievable, no more pain on my lung. And since then she had only very little rebuilding of the pleural effusion. Of course the cancer is not away, but the reason which produced or co-produced the cancer is away. So it's much better. I have so many such examples. Therefore, no more treatment of a chronic patient without including a correct dental treatment.
And correct dental treatment, this is the word, because it's not only to go to a dentist and pull a tooth. It is a big apparatus so you have around this kind of treatment.
Exactly.
Do you have some words about what do you do additionally to just take the tooth out?
First of all, the fact that you do take the tooth out and don't do root canals, very important. Secondly, if you don't believe, we have tests to show if here are white blood cells activation, if there is chronic inflammation. Everybody knows chronic inflammation is cancerogenic, so we can test this. Well, but we do a pre-treatment and a post-treatment. After the removing of the tooth, to release from the focus, we do ozone treatment, we do pulsed magnetic field treatment, which increases the healing, and we do the platelets. We take blood from the patients, we spin it, centrifugation, and then we take the platelets out of the centrifuge, and we take the platelets out, and the platelets of the human body is the carrier of the growth factors. So we put this platelet concentrate, we activate them, and we put them in the hole where you need growth, regrowth of the alveolar, the hole which is after removing. So in 6 weeks, the bone is rebuilt without infection. That's our process what we do before and afterwards. And then they get upbuilding IVs, infusion. So even in such, in this case, it's difficult to remove these 2 wisdom teeth. You really have to be trained.
Yes, this is
quite difficult.
Because they are so close to the sinuses.
Exactly.
Yeah.
Exactly. Yeah.
This is, my own nightmare to have this kind of stuff done, because one of my biggest fears in life was to go to a dentist. I had bad experiences as a child, and this was what I was fearing most coming to this clinic, that you start to take my tooth. But I'm very happy that you find one of the reasons why I'm so ill, because this have to be probably one reason who is pretty important.
When we have a patient like you, then, well, this could make heart problem, could make intestinal problem, but it's also, intestines is the organ of vitality. So you can have vitality problems. And you could also have mental problems. It's also the tooth of depression. Can be tooth of depression. Yeah. So we just test, and we do. Of course, on you with your disease, we would like to insist on doing the dental work, because it's one of the causes. There is never one cause. It's always multi-causal. Every disease is multi-causal.
Let's go a little bit to cancer. Breast cancer and prostate cancer is also something who we find very often in our society today. You say that cancer is a toxic illness. And can you tell a little about breast cancer and prostate cancer, and how this is created in the body, and a little bit of how you treat it efficiently?
We talk about cancer now. In Paracelsus Clinic, we have a lot of cancer patients. And in my practice, the cancer patients are more than 50%. So we treat cancer patients in all stages. We treat from diagnosis, which I like the most, or most of them, unfortunately, they already did many treatments, operation, or chemotherapy, or radiation, and so. Normally we get the patient when they have done a lot of treatments, and they come because of reoccurrence. Why does cancer reoccur? Because you do not remove the reasons. You don't co-treat the reason which leads to cancer. So we have to look very strategical, very widespread to all cancerogenic influences which could be around in your body. Of course, everybody has different, but we just look through. And there are toxic load, again, intestinal bacteria, which are cancerogenic, for example, Clostridia. And there is a lack of cellular integrity. Cancer cell has a different metabolism than a healthy cell. And it needs a different environment than the healthy cells. So if you change this cancer favoring environment to a healthy environment, the cancer cells, they lose their milieu, and they begin to become less active, less malignant. You pull, so to say, the electricity from their metabolism. That's what we do. We have treatments in cancer patients. We have a strict program. We do evaluation of the cause. It's never the cause, it's always multi-causal. Secondly, we activate and we test the immune system. And we do an immune upbuilding treatment, which is always combined with a intestinal treatment, because an adult person, our normal cancer patients, they have about 90% of their T lymph cells, the natural killer cells, the macrophages, who go to attack the cancer in the intestines. Diseased intestines, higher chance of cancer. This is even scientifically absolutely proven. Well, and the third thing is anti-cancerous treatment. And there we have many different means. Injections, alkaline injections, neurotherapies, which is also an injection technique. Then we do hyperthermia, heat treatment. We do pulsed magnetic field. Cancer cells, they hate pulsed magnetic field. And we do change of the milieu so that the cancer gets inactive. Of course, it does not always work, but it works very, very often. And for us, it's not even the big difference if a patient comes in a progress stage or in an early stage, because even the progress stages, they did not have this treatment yet, normally. So, if they are reactive, they react. And we have even stage 4 cancer patients, many, who just stabilized. Cancer did not remove, but they were inactive, and so they survive for long term. We have many such cases. Of course, not all patients. We also have cancer patients who die, but a bigger number than, especially in these progress cases, who profit from our treatment. So when a patient calls me, or the husband or the brother also, oh, my sister has breast cancer newly developed, we should do operation and then chemotherapy. No, you should not do you should first pre-treat, try to remove all the causes which lead to cancer. Then you can operate, okay, and then you have to post-treat biological. So you don't need to fear the reoccurrence, because the cause of the reoccurrence is that the causes were not removed. That's my strategy, and it works.
And if you have breast cancer early stage, or prostate cancer early stage, what is the probability when you come to you and get the full treatment that you can continue to live with a good life quality?
That's individual. We have to look. I hate the doctors who say, oh, we can treat cancer and it successfully. Always. That's not true. Never, nobody. But we have to look what are the reasons. And in early breast cancer, we have very good results. How do we measure? I made analyses of our stage 1 or 2 breast cancer patients who came with stage 1 and 2, not yet metastasized. And we observed them for 2 up to 12 years. Well, not everybody has 12 years, of course, but we observed only the ones after 2 years and more. And none of them became metastatic. So this is one, outcome which we have.
Then I guess you don't think so much about people who do a gene test and they remove both breasts because they have a gene mutation?
No, absolutely not. Absolutely not. I know this drama which was nothing than business. There was this actor, a horrible lady, who presented herself, I don't name her, but who presented, I'm BRCA positive, breast cancer gene positive. I have this chance, therefore, to remove both my breasts. This is idiocy, because did she also remove the ovaries? And what do they say to them? it also increases the chance of ovaries. But I have the counter question. Why do they only have a chance and not a sure cancer prognosis? You know what I mean?
Yes.
So, because the chance gets increased by milieu and environment and toxic factors. If we upbuild the milieu, if we remove all the toxins, if we upbuild the immune system, even if they have the BRCA positive, they don't get cancer. So a prevention mastectomy is only good for the gynecologist, for the surgeon. Only good. That's my sure convincement.
This concludes our first talk together, Mr. Dr. Rau. This is the introduction to my stay at your clinic, and
Yes.
next time we meet, we will go into diagnosing, because then we have all the data and the route you map out for me, what kind of treatments I get, and then we'll come back and show the different treatments and also the progress you hopefully make with me. I am 99% sure I'm in good faith, and thank you for being here with you, Mr. Dr. Rau.
Thank you also for giving me the chance to, and I think it's very important that you spread this word.
Yes.
We do a lot of seminars. Come to academy@paracelsus.com. We have an academy webpage. I do layperson teaching, I do speeches, and I do also professional teaching. We have our whole doctor's team. We do training a lot.
So your philosophy is not to keep the goodies and the secret sauce for yourself. You want to spread your experience to all who want to learn from you.
I tell everybody all I know, if this is possible, because the market is huge. If I have 1,000 colleagues who copy me, many thanks. So, well, not now comes the arrogant part, because until they are able to do the same thing, we are 5 steps ahead. So, because our medicine is always developing, what I do now is much more progressed than what we did 10 years ago. So it has to be a permanent evolution in this treatment. And for me, I'm now 67, so my purpose is to spread the word.